Why is high-risk HPV a risk factor for various cancers? Have you ever wondered why high-risk human papillomavirus, or HPV, is linked to various types of cancer? High-risk HPV types can lead to persistent infections that cause abnormal changes in the cells of reproductive organs and other tissues. If these changes are not detected and treated early, they can progress to precancerous lesions and eventually invasive cancers over time. HPV is a group of viruses with many types. Some are classified as high-risk because they are strongly associated with cancers, especially cervical cancer. High-risk types, such as HPV-16 and HPV-18, are particularly concerning because they have a higher potential to cause cancer. So, how does high-risk HPV lead to cancer? The virus infects epithelial cells, which are the cells that line the surfaces of the body, including the cervix and other reproductive tissues. Once inside, the virus produces proteins that disrupt the normal regulation of cell growth and death. This is mainly done by inactivating tumor suppressor proteins like p53 and retinoblastoma protein. When these proteins are inactivated, the infected cells can grow uncontrollably and accumulate genetic damage, leading to precancerous changes known as dysplasia. If the immune system does not clear the infection, the presence of high-risk HPV can cause these abnormal cells to persist. Over the years or even decades, these cells may progress into invasive cancer. For instance, in cervical cancer, it can take about 5 to 10 years for HPV-infected cells to develop into precancerous lesions, and around 20 years to develop into cancer. To combat this, screening methods like Pap smears and HPV testing are crucial. They help detect these precancerous changes early, allowing for treatment that can prevent progression to cancer. Additionally, vaccines targeting high-risk HPV types can prevent infection and reduce the risk of developing HPV-related cancers. While high-risk HPV is particularly relevant for cervical cancer and other reproductive tract cancers, such as vulvar, vaginal, penile, and anal cancers, it is important to note that testicular cancer is not linked to HPV. However, the virus's role in reproductive cancers underscores the importance of prevention, screening, and vaccination to reduce cancer risk. In summary, high-risk HPV is a risk factor for various cancers because it can cause persistent infections that disrupt normal cell regulation. This leads to precancerous changes and, if untreated, invasive cancers primarily in the reproductive tract and related areas. Early detection and prevention strategies are key to reducing the burden of these HPV-associated cancers. Always consult healthcare professionals for personalized medical advice and guidance on screening and vaccination options.